For many, the newfound freedom from the mask has them rediscovering their smile, although it's also revealed the flaws they may have been hiding this past year. So to help us get ready for a summer of pearly whites on full display, we are turning to an expert in restoring your smile.
And I am so happy to welcome to Daytime for the first time, Dr. Stephen Davidowitz, also known as Dr. D. So thanks for being with us.
It's great to be here.
All right, I know people have been putting off the dentist, right? The past year for obvious reasons. Now we're kind of getting back into that, right? We're getting back into the routines that we've missed. What are you seeing, Dr. D?
I'm seeing two phenomena that's occurring in my patients coming into the office. One of them is fairly obvious. A year and a half of staying away, staying safe, unfortunately led to neglect, forced neglect of our oral health. So whether it was some poor habits at home, maybe not doing the 2 minutes of brushing twice a day, flossing, staying away from the wrong foods, perhaps it was grinding, clenching of the teeth during the day. Perhaps it was the fact you couldn't see your favorite hygienist and dentist to make sure the teeth are at their optimal place. So when they're coming in, they need us right now, and we're here for them. The second phenomenon is that people want their smiles to look amazing once that mask is off.
That's right, and we see them in Zoom a lot now, so we can pay a lot closer attention to what's happening. So I'm sure that teeth whitening is also rising in popularity.
There's not one patient that's coming in not inquiring about whitening. Is there something we could do better than what we're finding on the shelves in the convenience stores and the pharmacies? And the answer is yes. Having a professional whitening is always going to yield better and safer results.
All right, we know that those things are aesthetic in a lot of ways, but let's get to the basis because people do want to make sure the teeth they start with are their healthiest. So if they have not been in over a year, what are some of the first things that they should get done, that they should ask about, that they should be doing at the dentist?
So, people come in with their wants, their aesthetic desires, and we stop them. We, put the hand up, we say, we get it. But you need that foundation. You need the gums and the bone and the teeth to be in a really healthy state before we move on to that aesthetic cosmetic procedure. So the first step is really to get that professional cleaning, get the gums checked out, make sure that the baseline is there. For those that are wanting the cosmetic procedures and their teeth are healthy, but they're all crooked, maybe they didn't wear their retainer for the past year and things have actually shifted, it's probably not the right time, unfortunately, to just whiten and say we're done. You should actually straighten those teeth first, get them into a better position.
And we know, Dr. D, that you actually do a lot of smile makeovers. You've mentioned some of the tools you have, but let us know some of the other things that are out there, the newest technology kind of that people are utilizing when it comes to getting that perfect smile.
So there's really neat devices now that we're using that are really minimally invasive. And what I always do is when I teach this and when I do the work on my patients is a holistic approach to a smile. So sometimes if you look at a photo in a magazine or on TV and you want that smile, but you take it and you put it into your mouth, it may not work for you because the frame has to match. Everything has to match up. So we have things here in the office that actually help frame the smile. One of those technologies is called Evoke. And Evoke is this bipolar radio frequency, hands-free device, no downtime. And it literally rejuvenates the frame of the smile by tightening the jowls and getting rid of some of the stubborn double chin area fat. And that does a tremendous boost to my smile makeovers when I could give a really perfect smile for that person that fits the frame, but also make the frame look better as well.
And I'm sure you leave your patients with some suggestions for just healthy habits, right? We're all at home. That's where we get our start. What are some of the things that we should remember to do?
So, the basics of oral hygiene, you want to make sure that you are spending the proper amount of time brushing your teeth, doing that twice a day, making sure you're using the floss. Floss is important. It's not just to get spinach out of the teeth. It's there to help protect the gums and the bone that's holding the teeth in place. And lastly, if you find yourself clenching during the day, which many of us have done, you're probably also doing that at night. I've seen so many patients coming in with broken fillings and crowns and all these issues, and they never had it before. There was so much stress. If you find yourself doing that during the day, stop for a moment, breathe, keep your mouth slightly open, And if you feel that you may be doing this at night, speak to your dentist, get a custom fitted night guard, protect the precious enamel, protect all those restorations that you may have in the mouth.
Yeah, and mostly get back to the dentist. No longer should we ignore these basic things. So, Dr. D, thank you so much for your advice today. It was great to meet you.
It is really great to be here. Thank you, Robin.